It's a real honor to be in the company of an international array of distinguished scientists, all gathering around from their respective fields this program, as has just been discussed. I think what we want to offer in our presentation is kind of a story of how a provincial government got interested in the program and did what we could to add to the knowledge base around its effectiveness. And so I was thinking about a catchy subtitle, since you get to do that in a presentation, and I thought that, that famous book by Dale Carnegie, How to Win Friends and Influence People, which was published about 75 years ago, was helpful because there was a book that had broad-based appeal that really talked about how to relate to one another, very much like the Roots of Empathy program. And around the same time, a journalist named Walter Lippmann had this quote that's still important for the discussion that we've just been having about the gap between research and practice. And Lippmann said that unless we are honestly experimental, we greatly imperil the future and leave the great questions of society to the ignorant advocates of change on the one hand and the ignorant opponents of change on the other. So the idea there is really that we want to bring the best scientific evidence to the debate. Otherwise, it's just the ignorant versus the ignorant, stated kind of starkly. I think Jean has already credited, as Mary and others have had, that we walk in big footsteps. In Mary's book, credit goes to Fraser and Dan and their work, their insistence that we used science and use it for the betterment of others. And then the quote from the acknowledgement section about measuring what we treasure is really important. Leanne Boyd is here. I want to credit her especially. She's overseen the implementation of Roots of Empathy across the province of Manitoba, one of my mentors. This is Mary and Leanne at Fraser's funeral back in November, where we've continued our discussions. Oh, I'm sorry. I'm clicking my own slides. Here's the Carnegie book and the Lippmann quote, Fraser and Dan. Thanks, Leanne. And then here's Mary and Leanne back in November. I also want to credit my two most recent teachers. These are my kids 5 years ago when they turned 1. It's very true that there's a lot that our children can teach us. Full disclosure, the trial I'm going to report to you was completed before I let Mary near my children. But of course, they sensed her compassion right away, and they are very choosy chickens, and they took to Mary very quickly. And they were quite sick this evening when Mary asked us to visit it while she was doing some training in Manitoba, and have loved her ever since. This is just an example of one of the many classrooms in the province of Manitoba that's doing Roots of Empathy. We started it as a full school division trial back in 2001, and the results I'll report here, which have been published, started in 2002. I want to credit our provincial government. Lisa's already in the introduction commented on the Healthy Child Committee of Cabinet. This is a unique structure in Canada. It's the only legislated cabinet committee dedicated to kids in the provincial governments across our country. On the top right is Tim Sale, who is the founding chair. He's since retired from politics. He's a unique one, and one of his roles later on was to serve as a board member of Roots of Empathy, because he was one of the ministers that brought the program to the province. And that leadership and support has continued across those 10 departments that serve children. In terms of other acknowledgements, these are the co-authors on the trial, Jean Whalen, who really oversaw the data collection, Mariette Charté, who insisted that we analyze the data, Dan Chateau is our biostatistician at the Faculty of Medicine, who's helped us manage the complex clustered data and the long-term data in the trial report, and of course the schools that collected the data for us. So in terms of dissemination, there is a copy of the article online published in just about a year ago in Healthcare Quarterly. So I'll just give you a very brief presentation. It hasn't been presented at a scientific conference before that. There's a segment in the second appendix in Mary's book in the online edition. And I forgot, David Bornstein's here from the New York Times. I neglected to reference that probably the most significant dissemination of this work so far, which was in his own work at the Times, which the Premier hadn't read our article yet, but he read the piece in the New York Times first. So in terms of the background, this is important because of the discussion we just had about how we go about making choices, public policy, using public dollars to hopefully improve the lives of citizens, including children. And so about 10 years ago now, it's stunning to think how long back this goes, there was already enormous demand for Roots of Empathy in Manitoba and across Canada. The program itself had just been about probably 5 years old at the time, 6 years old. And already the enormous amount of requests from schools, from teachers who had heard about it, was overreaching the limited resources our office had to implement. And so those of us on our scientific team saw an opportunity where that supply-demand imbalance creates the opportunity for a very strong evaluation design. And was predicated on some basic principles that I think science and practice both share. One was that there needed to be fairness. All too often in the implementation, especially of new programs, it's sort of first come, first serve, or the squeakiest wheel, or people know people, and then that's how people get programs implemented in their communities. We sought to have some fairness, and so we decided early on that because of that supply-demand imbalance that we would run a lottery so that every interested school division that had expressed interest by a certain date would have an equal chance of participation. Equity was important as well, and so we guaranteed that the school divisions that didn't, quote, win the lottery in the first year were guaranteed to get funding and training to implement the program the subsequent school year. Rigor scientifically was important, so the lottery, as you know, approximates a randomized design, in this case a clustered one, because the program is implemented at a group level in classrooms, and we actually clustered it up to the school division level by requiring that requesting school divisions would designate prior to random assignment which schools and which classrooms and which schools and which grades that they wanted to implement. And I'll talk a bit more about that in a second. And then, of course, the ethics of this was important because all too often big decisions are made about large-scale implementation without very much evidence. And it was really important for ministers and for the community that we had good evidence that before we grew the program in Manitoba that we really want to know what it was doing in terms of outcomes, as well as the imperative to not do harm and to make sure there weren't unintended negative effects, which all too often with well-intentioned programs has been documented in the literature. Not to mention securing funding and making the case for growing the program from a funding standpoint. And then here I want to quote Surya Chalmers, who was one of the co-founders of the Cochrane collaboration, which is the first ever systematic combination of the evidence and medical and health interventions. And he talks about a double standard, which I want to highlight as important both for science and practice, which is that in the case, and there's a quote here from the 70s from Richard Smithles, who says that as a physician, I need permission to give a drug to half my patients, but not to give it to all of them. And this double standard about the additional requirements for research is important because the reality is when decisions are made about programs for children, all too often there's very little evidence behind it. And in fact, what is actually happening is experimentation with children, but without any benefit, without any knowledge gain that's rigorous enough on which to base decisions. And so you have this odd double standard of requiring enormous and entirely important procedures for research review for a randomized trial where half the kids might get a new untested intervention. But elsewhere in jurisdictions, people will actually implement those programs to everybody without any evaluation. So we wanted to balance that challenge. And so the next two slides sort of show the flow through of the trial. So this started 10 years ago in the 2002-03 school year. 8 school divisions expressed interest by the August deadline. And then we, as mentioned, we required that they pre-stratify by 3 grades, kindergarten, grade 4, and grade 8, because we had similar questions as has just been discussed of what is the optimal timing or age of the intervention. The R there is the lottery, so the randomization happened after pre-test measures were taken from teacher reports and from self-reports from the kids at baseline. And we used measures, reliable and valid measures from the NLSCY, the National Longitudinal Survey of Children and Youth, as our outcome measures. And so we had enough resources to implement routes in 5 of the 8 school divisions, so that had 17 schools, 24 classrooms, and 444 students. And in the waitlist control group, the ones who were waiting a year to get the program, 3 school divisions, 10 schools, 12 classrooms, 315 students. And then for both groups, we followed their immediate outcomes at the end of the school year, as well as 1 year, 2 years, and 3 years after program completion. And so that's the longitudinal follow-up that we did. And then for that bottom group, the waitlist group, in the second school year, the subsequent school year, that same set of 3 school divisions, 10 schools, 12 classrooms, but with a new group of students that next year. So kids coming into kindergarten, the new grade 2s, or grade 4s, and then the new grade 8 students got Roots of Empathy the subsequent year. We also followed that group right at the end of the school year, 1 year, and then 2 years after they completed the program. And then in a kind of a twist, we compared them to the control group from the previous year who happened to be in the same school divisions and classrooms. So we've kind of got a replication group going there as well. So to summarize the effects, these are standardized effect sizes using Larry Hedges' adjustment for clustered data. The green bars show that first implementation group. The first implementation group, and then the purple are that replication group that got it in the second year. And so going down on the chart are reductions in the outcome, and then bars going up are increases. And so as hoped for, these are all statistically significant, p less than 0.05. We had significant and meaningful reductions in physical aggression in both groups, and in indirect aggression, a particularly big effect in the first cohort, and then sizable increases in prosocial behavior. And so physical aggression these are teacher-reported data. So these are things like bullying others, picking fights, biting and kicking. Indirect aggressions, all the social exclusion type behavior, trying to get people against another child. And then prosocial behavior, things like helping one another, helping a child, or comforting a child who's in trouble or distress. And so this is, the immediate impacts are quite evident from the teacher reports at the end of the school year. And then the follow-up was interesting because our statistician advised that the next set of analyses should compare the post-test group time point to up to 3-year follow-up. And so for the replication group, that's up to 2 years follow-up. And so what you want to see on this chart are non-significant effects. In other words, that the differences immediately after the program persist over time. And so that, like if I just go back to the previous slide, so you want those differences that you see here at the end of the school year to continue in subsequent years up to 3 years after, in this case rated by different teachers. And indeed, for almost all of those outcomes, we find statistical non-significance, which indicates that those between group differences are maintained over time. And there's this interesting findings on both sides. So there was a peculiar finding where it looked like physical aggression kept being reduced over time, and prosocial the opposite. And so just to summarize, as mentioned, we did find statistically significant immediate effects on all the 3 outcomes as rated by teachers. When we averaged those standardized effect sizes, it was about 0.25 of a standard deviation, which when we compare that to meta-analyses of similar programs that Sandra Jo Wilson and Mark Lipsey have done recently, we find something very important for a new program that's already quite popular, which is that it's comparable to model programs that have been evaluated in the literature at about 0.21, and it actually performs better than ones that are being done in routine practice, which is what we were actually looking at. This was an effectiveness trial of real-world practice. And so when you convert that average standardized effect size to sort of more everyday terms, it's the equivalent to reducing a baseline of about 15% of bullying, say, in the classroom or in the playground to about 8%, or about cutting it in half. And that's what David reported in his New York Times piece. We replicated those same effects with a waitlist control group with somewhat attenuated effects on the aggression outcomes. And that might be for a variety of reasons, including being from the same school divisions. And then, as mentioned, we maintained those. We observed a maintenance of those effects over 3 years, across all the outcomes. There were a couple things that seemed worthwhile to explore further in other research. That this impact on physical aggression seemed to continue even up to 3 years later after they'd stopped doing the program, and prosocial gains seemed to slow down a little bit, so they didn't quite. They were maintained, but not quite as strongly. And then some of the discussion, I understand it here, sorry I missed some of the presentations around things like gender and age and timing of intervention. We found largely no interaction effects when we looked for moderator impacts, but there are a couple of interesting findings that might bear further exploration. For immediate outcomes, in one of the cohorts, there appeared to be a stronger effect of the program on reducing indirect aggression in girls, which is interesting because that's a more common form on average among girls versus boys. And it appears to be a particularly strong impact in improving prosocial behavior in younger children, kindergartners, versus the older children. Over the long term, this is also worth exploring and replicating, is that the gains in improving prosocial behavior might fade in boys compared to girls, and might fade in older children versus younger children, which is consistent with the larger corpus of what we know about the development of aggression, gender differences, and so on. But apart from those things, there are very few differences, which is important for a program that really wants to reach all ages and both boys and girls. I will say that we did look at student-rated outcomes as well, and we found almost no statistically significant effects from a student's perspective on these outcomes. So these are really very clear from the teachers' perspectives. When we looked at the literature and those meta-analyses, the majority of similar studies use teacher ratings. They're the most easy to collect. They have the same challenges that Kim mentioned around blinding or lack of masking. It's only in about 1 in 4, 1 in 5 studies that any student-rated outcomes are collected. And parent-rated data is very challenging to collect, and we actually found that too. We tried to do that, but we were on a shoestring. There was no evaluation budget, and that's something worth doing in later research. And then lastly, this is an important message in the article, is that it's really incumbent on all governments as stewards of the public dollar, of the public trust, to really evaluate untested programs as strongly as they can, random assignment included, prior to larger scale implementation. And then just in closing, some things that we've been thinking about theoretically, as well as some continued empirical work that we're just embarking on. From a theoretical perspective, a lot of the work that all of you have presented here and the traditions that they are grounded in really connect to that section 2 in Mary's book around the 6 strands of human connection, from the neuroscience all the way to social inclusion, exclusion. An evolutionary framework is helpful from the growing evidence about how this is really built into our ancestral heritage, our DNA, and how that's expressed for better or for worse epigenetically, given the current conditions that you've just been discussing. There's a recent paper just published a couple months ago in Developmental Cognitive Neuroscience, Jean Desetti's work around this framework, and a really excellent literature review in this area. And then it's also helpful to look to other fields. So Elinor Ostrom shared the Nobel Prize in Economics back in 2009 for really showing with a whole bunch of evidence that was quite compelling that what was formerly believed to be the tragedy of the commons, that when you've got groups together, there's self-interest operates and we basically can't get along, is actually not always the case, and it isn't not our fate or our destiny, that under certain conditions, groups of people are actually capable of managing common resources that are all highly valued together under certain conditions. And when you look at, I don't have them listed here, they're very similar to the kind of basic principles that roots of empathy and the allied research are really founded on. And so here we have, I think, a microcosm of what's really quite ingrained in our evolutionary heritage. And it may be a partial explanation that can be tested as to there's something about this program that people see, especially when they observe it in person, that just connects with that. And it probably has a lot to do with exactly those evolutionary bases. And so while the program is described as a revolutionary program, and it may in fact be doing that based on evolutionary premises. And then empirically, we're just embarking on a longitudinal follow-up of our cluster trial. As one of, I think, 14 provincial government programs that are being offered for children in Manitoba, we partnered with the Manitoba Centre for Health Policy at the University of Manitoba and we successfully competed for a $2 million 5-year grant to look at the long-term health and social impacts of all those children's programs, including Roots, over the long haul, including whether there was an impact on reducing inequities in those outcomes. And so we'll look at socioeconomic gradients and things like that. And so the advantage that the province has and the center has is that all kinds of administrative data about the health of the population, things like injuries to hospitalization to mental health, diagnoses, educational outcomes like assessment results from grade 3 on to high school graduation, social outcomes like whether teenagers went on to become parents, pregnant or parenting. And a new data set just added to the repository looks at criminal justice data, so things like incarceration. So all the kinds of things that you'd expect to see improvements in over the long haul as a function of building that early emotional literacy, that empathy early on in life, as well as whether we've been able to level the playing field and close the gap in terms of inequities in those results, particularly for disadvantaged kids. And then just to kind of close on a lighter note, lots of great quotes in Mary's work, including her book, and she opens the book on page 7 by saying that the classrooms of the country are a microcosm of society, and I think that's where that evolutionary perspective might be helpful, because it really is a mini world in the classroom. And then later on, 70 pages later, she talks about there's no point in crying for cabbage if you planted corn. I love that quote from Newfoundland. And that's the same point, is that that's the idea of sowing and reaping. It really is very clear now, at least in Manitoba. We've since grown the program. It's in 300 sites, 5,000 kids a year, 40,000 kids served over time. Just starting a trial for the Seeds of Empathy program in preschool, and really trying to make those investments early on so that we can get our cabbage down the road. And so just thanks for the invitation. It's a pleasure to be here, and I look forward to a discussion. Thanks.